vagina, the vulva is the outside part of the pelvic area, the female part. We refer to it as the vagina, but the vagina is actually the inside part. The vulva is on the outside with the lips, and then we get the opening of the uterus, the opening of the vagina. That's where you enter, and that all of that whole area where the clitoris is as well. That whole area is loaded with blood vessels and nerve endings. And through the process of chemotherapy and radiation, there's a lot of damage that's done to that area. Apart from that, the fact that there is no estrogen is like the face cream to the vagina. I always say we have a public face, the one that all of us can see tonight, and we have a private face, and that is our vulvas and vaginas. So the estrogen is so necessary for that vulva and vagina of yours to function well. Now, anyone with breast cancer knows or are aware of the impact of estrogen on cancer, and we just want to run away and don't even consider thinking that it's possible to use estrogen. But there's different types of estrogen, and we use estriol, which is absolutely safe in the vagina. And if we can apply that in there, we can the epithelial lining that's so thin and almost non-existing, we can regrow that area, and that will give a lot of protection, and it will help for the epithelial and the sensation and everything to be restored. So although there's a lot of nerve endings that is affected by the chemo and the radiation, we can repair it with something as easily as easy as estriol cream, and that differs from woman to woman. We usually start with the first 6 nights. You have to apply it every night for 6 nights, and then we try to do it maybe every second night for a month. After that, twice a month, and we slowly build it up to where you as an individual are. Maybe you'll need once a week, maybe you'll continue to use it every single night. It's such a small dose, it's such a low percentage of estrogen, and I always say the vagina is like a cul-de-sac. It's not going to go into the rest of your body, but your vagina really needs that estrogen to become alive again. Apart from that, the normal lubrication is actually not formed anymore. And to help with that lubrication, to bring that back, it is good to use something like hyaluronic acid. And I've got one example here tonight. This is a box. It's called Hydra V. It is also available in pessaries that you can use. It comes with applicators, which are fairly sharp to use sometimes. So in some cases, the pessaries are better. But this is what the serum looks like, Hydra V. This is absolutely not containing any hormones. It's hyaluronic acid with vitamin E and A that you can use in the vagina. So if you alternate between an estrogen cream and this Hydra V,
My question about the cream is, so you use it vaginally, and then the hydro gel also vaginally.
Hydra V. So this is a gel, a serum that you could maybe that's easier to start. So one can alternate between estriol cream, Synapores that you can buy at the pharmacy, and this Hydra V you can actually order directly online from formulate.co.za, and you can just say that you want Hydra V serum, or you could say you want the pessaries. It's not something that needs to be scripted from your doctor. So this Hydra V you can actually just get from the compound pharmacy, if you combine that with the Synapores, it really helps a lot to improve the moisture effect in the vagina quite significantly, and that takes a lot of the burning away. But it's not always the only magic bullet that we need. If it's not improving, then it might be necessary that we add something to work specifically on the nerve endings. And some medication that works well for that is gabapentin. Now, gabapentin is a kind of medication that works on one's nerves, and especially it calms down the nerve endings. Because over time, like I said, that area has got about 10,000 little nerve endings. That's why it's such a sensitive area. And once you've had painful penetration, your brain remembers that. And every time that you just think of having intercourse, you actually freeze, that you tighten up, you pull everything in there together, and that goes deeper than just the inside layer. It goes to the muscles, and then we get spasms in there. Now, to take that sensation of the nerve endings, to calm that down, the gabapentin can be added to a mixture that we called sometimes the 4x4 or the 4x5 cream. 4x4, it is usually this estriol that we put in the cream. We can add the gabapentin, and then we put 2 kinds of numbing cream, like a topical anesthetic cream that's safe for the vagina. We can put that in there, and over a period of time, that calms down that nerve endings, and that takes that real burn sensation, sharp, sensation away. But one has to remember that you have to be very patient with this process. It's not a quick fix, like you're going to have. You apply it in the morning, and by tonight there's going to be magic. It takes weeks, and it makes us fed up, because we want things to be fixed. And with breast cancer and the side effects of that, it's different. We have to see this as something that we need to include in our routine as a woman. That we need to. That's why I like to refer to the face. It's a public face and a private face. We really need to keep the private face moisturized as well. Where without breast cancer, that would have happened on its own. So that's the 2 things that we can do, or the 3 things that we can do to address that pain. But Laurie, like I've just referred to, sometimes we try so much and so hard that the pain actually comes from the muscle. So it's like a second layer. We first of all address the lining of the vagina, but then there's the muscles, the pelvic floor muscles that supports our vagina. Everything around there is like in a little hammock, from our anus, our vagina, the opening, and the urethra, and it's all connected to the pelvic bones, and it's quite a big group of muscles coming together. And your brain is just programmed like that the moment when there's pain and something is hurting you or doing harm to you, your body's first instinct is to protect you, and it does it by closing up, absolutely closing up that vagina. It's not going to smile and say, welcome in my paradise. It's actually, give you
clenching.
Clenching, like clenching your teeth. It's what happens to the vaginal muscles. And for that, it is 2 things is important, I think, and that is the help of a physiotherapist, especially if you feel sharp pains, not just burning, sharp pains with penetration that's almost like a knife stabbing into your vagina, then that is from the muscle. So where the muscle usually under normal circumstances contracts and then relaxes completely, this doesn't happen. It contracts, and then instead of completely relaxing, it's getting stuck halfway, and then the next time it has to protect you, it contracts again, and it just becomes like a little knot. I often say it's like this knot that we get in our shoulders when we are stressed or sitting like this. It can become quite painful, that you need someone with an elbow going into them and giving you some relief. It's the same kind of spasm that we get in the vagina. And it is so important that we get the help of a physiotherapist, but not just any physiotherapist. There's a handful of the physiotherapists that I know that are trained in treating the pelvic floor. They are physiotherapy clinicians with a special interest in the pelvic floor, and it entails that they insert their finger on the inside through the vagina, and they really work that muscles. Every muscle is also covered with a special layer called the fascia. And the fascia sometimes get also, it doesn't stretch. And with the physiotherapy, they can stretch and mobilize that fascia again to give us the playful movement that we really, really like. Someone asked, what about Vagifem? Vagifem is a estradiol. Now, that's one of the 3 kinds of estrogens that we get, but it's not safe in breast cancer patients. So that is so important that women without breast cancer, they can use Vagifem without a problem, but women who's had breast cancer must stay away from Vagifem. Or estrogen cream, the normal estrogen cream. This one, it's called Premarin cream, and it's available. But please don't use this. There's the type of estrogen that's in here is the same that is in Vagifem, and that can restart your cancer. So we know that Synapause, the estriol one, is safe. The other thing I wanted to talk about with regards to pain is anxiety, because anxiety plays a big role, and it's absolutely understandable. Just fighting to become a champion, to become a survivor of breast cancer is a fearful, frightening experience. And we all go into the fight and flight mode. It's a matter of survival, and our bodies, that becomes our go-to mode of thinking. And when we are in that mode, we take breaths coming from here, the apical parts of our lungs, and we don't use the whole of our thoraxes and the whole of our lungs. So we really breathe very superficially. And that leads to, or that's connected to the nerve, the vagus nerve. Now, with the vagus nerve, that is our fight and flight response. Now, he's responsible for that. Now, that nerve has got another function, and that is to supply your pelvic floor. So if you are in a fight and fight mode, that pelvic floor of yours is ready to run to get you safely from point A to B. And that leads also to the tension. So in many cases, the physiotherapist will help you with relaxing exercises that entails deep diaphragmatic breathing techniques. Now, it sounds incredibly silly to do it, but it's such a wonderful thing to use as a tool to calm yourself down, even in any situation. It's such a lovely tool. If you feel overwhelmed, if you feel a little bit frightened, just to do deep diaphragmatic breathing techniques. And there's a physiotherapist that is, she's got a 6-minute YouTube video clip that I could send you, that you can share. She's Dee Hartman. And women can even start with that. There's 5 exercises on there. And if you can just learn, one of them is called the physiological sigh, where you really fill your lungs up to full capacity. And when they are full, you think they're full, you take a sniff. And once you've taken that sniff, you start to exhale slowly over pursed lips. And I tend to put my finger here as if to stop the airflow. Like that. And you can actually feel over time, not so short, but at least 7 to 10 seconds you need to exhale after you're filled with the sniff. And that's the physiological sigh, and that calms down the vagus nerve, and you will feel how the stress just goes out of your body. You feel it going out of your muscles, and the pelvic floor will start to relax. So that's one of the 5 exercises that she shows. And so you can see there's many aspects coming in here that's really not like Viagra. There isn't a little blue pill that we can use. It's a pity. But women are far more complex and interesting, and we can't be fixed with a single little pill. We must use all the modalities that we have available to address this problem. But just remember that it's not always just the estriol. It's the estriol. We need to remember the moisturizer. We need to think, if it's not from the nerve endings, that we need the gabapentin, and not forget the muscles that can also play a role, and anxiety, because we are so anxious to get it right. And the more we think about it, the more tense we become. So it's so important to relax. I cannot overemphasize that anymore. We need to talk about intentional planning of sex, being intentional in life. The other thing is just to well, that I was thinking with this breathing, sometimes while he's busy with foreplay, do some exercises like deep some of those exercises that's not so obvious like the sigh, but some of them, it is possible for you to do it while he's playing with your clitoris on the outside and getting you there. And it is important what you've said to whilst he penetrates to exhale. The other point that I do think helps a lot is to position yourself. If you are doing the very familiar missionary position, it's so important that you don't keep your legs, in line with your body. The best way is to open your pelvic floor and let it relax, as much as possible. Now, a way to do that, I usually say, is to lift up your legs to your chest and then open wide. All right. So in that way, when it's almost like you are squatting, put your hands underneath your legs and support yourself. And if you want, put your legs on his back, to rest, if that helps you. But really, if you are open wide like that, you cannot clench at all. So if you then exhale, there is space and the muscles cannot contract. So that is something. And then, of course, if you are a little bit adventurous, you can obviously move from the missionary position to sitting on top, doing the cowgirl, where you squat over your partner and you control the direction and the speed with at which penetration happens. That's also practical things. We really need to think about this, what's going to work. And I always encourage patients to think, in this position, how can I go over, or how can I get to the closest I can? What can I do to get the closest to a squatting position with my pelvic floor? That is important. And then before we go to intentional sex, I think there's two. I prefer a water-based lube, because the vagina is actually such a beautiful, fantastic organ. She cleans herself out every 7 days. She makes new cells. And the reason why, with the lack of estrogen, some of the burning sensation that we have is the duration of the cell length. The cell's life cycle becomes shorter. So instead of being there for 7 days, it's usually it reduces to 3 to 4 days, the cell cycle. And if we add the estrel to that, it becomes longer again. They're more mature and they can take the punch of a penis. For me, like I said, I prefer water-based, because the best way to treat your vagina and to wash the vulva is to only use water and no soap. No soap, not even Dove, that claims to have a moisturizer in it. Just don't go with soap near that area. It dries it out, and it takes away the good bacteria. In the vagina is a lot of fluorides, a lot of organisms in there that keeps the balance in there very happy. And our pH in the vagina is between 3.8 and 4.2. So you can hear it's such a tiny area that we have for any margin of error is so small. So if the pH shifts towards the alkaline area phase, the bad organisms, they grow and they are happy, and that also interferes with how we feel and what we feel on the inside. Apart from the discharge that we get, it really becomes a hostile place in there. So please try to stay away from any soap in that area. For me, the water-based, it's a South African branded one, and you can order it from Take a Lot. it helps to control the pH in the vagina, and the same with the one from Femagene. And I mean, I'm a disclaimer, I'm not getting anything from these people, but why should I keep this information to myself? So sorry for sharing the brand name of it, but this is the good stuff. It's also the personal lubricant from Femagene, and both of them, they work for you. And I don't know if anyone ever taught you what to do with lube, because no one ever taught me. I had to figure that out myself. And I thought you put the lube on yourself, on the outside of your vulva and the introitus. It's not where it should be, because that's not where you need it. If your partner's penis is correct, you put the lube on him all the way down from top to bottom. They actually love the touch and the sensation of that. And then when he penetrates is actually going in there where your body needs it. That's where the lube will be applied. But make sure, some people like silicone lube. I just prefer a water-based one, because it's good for the vaginal health. It helps to keep our private face healthy. Even this hydrogel V serum one can use as a lubricant. If in the beginning, if it's incredible, if you're still on that almost daily regime of moisturizing the vagina. But all of this is safe.